Hello, I'm Mandy Waters, and I'm going to be doing a history of present illness and other medical history today on Jared, who is my patient. Hello, Jared.
Hello.
Nice to see you today.
You too.
Just want to kind of gather a little bit of medical information about you, if you wouldn't mind answering a few questions for me. Okay, can you tell me what brings you into the clinic today?
I have congestion in my sinuses,
Do you get that often?
usually once a year,
Okay, so when did this first start occurring this time?
about 5 days ago.
Okay, what kind of symptoms have you had with this besides just the congestion?
I have burning and headache
Can you kind of tell me where you're having burning sensation at?
through here and through the front.
Okay, and headache that comes and goes, is it all the time?
Mostly in the afternoons.
Okay, any runny nose?
Nope,
Any sore throat?
nope,
Any ear pain?
nope.
Okay,
Sneezing.
sneezing with this? Okay, and you said it occurs about once a year? Is it
Usually when
usually?
the seasons change.
Okay, so usually about this time every year? Okay. So can you tell me what kind of, other than what you're here for today, other kind of medical history that you have?
Very little, pretty healthy.
Okay, so ever had any kind of hospitalizations, any illnesses that occurred for long periods of time?
Nope, just as a child mostly.
What did you have as a child?
I had hernia repair, tonsillectomy.
Okay, and so last surgery was when you were much younger, is that correct?
5 to 6 years old.
Okay, so no history of any cardiac problems, respiratory problems, any, chronic sinus problems, anything like that?
Sinuses, seasonal allergies,
Okay.
chronic seasonal allergies.
And so as far as your surgical history goes, hernia repair and tonsillectomy, correct? That's it?
Mm-hmm.
Okay. So can you tell me a little bit about your family history, a little bit about your mom and your dad?
My mom's medical history is pretty insignificant, and my dad's is very significant with cardiac disease and high blood pressure.
Okay. And is your mother still living?
Mother is still living.
And is your father still living?
No, he died at age 42 from cardiac.
Okay. Did he have a heart attack at that time?
Yes.
Okay.
Second heart attack, had his first when he was 39.
Wow. Okay. And so how about siblings?
I have a twin brother and a younger brother. Both of them are in good health. Um, Twin brother kind of suffers from the same problems, seasonal allergies.
Okay. And grandparents?
Um, Maternal grandparents are still living, both in good health, both in their mid 80s. Paternal grandparents have all deceased, all from cardiac related.
Okay. So pretty strong family history of cardiac
On
problems.
the father's side.
Okay. Do you take any medications, Jared?
I do. I take flunicillide nasal spray daily, um, Allegra.
And what do you
daily.
take the nasal spray for daily?
Just the routine symptoms like I have now.
So it doesn't happen just once a year, apparently, correct?
As long as I take the nasal spray, it doesn't happen.
And what other medications do you take?
The Wellbutrin.
Okay. And are you allergic to any medications?
Nope.
Okay. And do you take your medications pretty, are you pretty compliant with that?
Mm-hmm.
Okay. Okay. As far as social history goes, do you drink any alcohol?
Just socially.
Okay. So how would you describe socially? Do you drink daily? Do you weekly, monthly?
Weekly.
And about how much do you think you would drink a week?
Less than a 6-pack a week.
Okay. And do you smoke?
Nope.
Do you use any other kind of tobacco products?
Nope.
Okay. And what do you do for a living?
I'm a nurse.
And how long have you been a nurse?
13 years.
Okay. And do you exercise?
Daily.
Daily. Okay. And what are your living conditions?
Live in a single family home with my wife and children.
Okay. And are you up to date on all your immunizations?
Yes.
Did you get your flu shot this year?
I did.
Have you ever had a pneumonia immunization?
I have not.
Okay. Okay, is there anything else you'd like to add? Anything else that you would like to discuss today before your scene? Okay, thank you very much, Jared.